Hello everyone, this is Chadi Alraies from New York EVS. I'm very privileged to be with Dr. Jose Wiley, who's one of the faculty and also the chairman of cardiology at Tulane University School of Medicine. Dr. Wiley, thanks for being with us.
Thank you for the invitation.
So offline we spoke about the historic aspect of EVS and how it evolved till now. Let's start going the past.
Sure, thank you. So the New York Endovascular Summit has been going on for the last almost 20 years. It started part of a combined program with the coronary symposium at Mount Sinai, and several years ago it branched out into what is now called the New York Endovascular Summit. Over the years, the platform has increased tremendously. The complexity of cases that are being presented have significantly grown, and the educational component is, in my opinion, probably the best endovascular program in the United States, if not in the world.
And I saw part of the agenda, I saw the live cases, and also how important it is for them for the fellows course.
Yes.
So tell us how was always the vision, or this is something kind of evolved over time?
Yeah, so the primary vision of the course was to educate. Not only to educate practicing physicians, vascular surgeons, interventional radiologists, or interventional cardiologists, but also the new generation, the fellows in training. The first day is dedicated to them, where all the focus is on them. They have live case presentations, they have multiple conferences, and they also have a cadaver lab where they learn how to use some of these devices hands-on, which is something that separates this venue from many others around the country. And then the next few days is the large symposium, as you see today and tomorrow, where you have world experts giving talks, having international live case being presented, as well as national presentations. So you get in 3 days a very comprehensive review of endovascular interventions.
Absolutely. In your book, Dr. Wiley, you are a chairman, you are a busy endovascular operator as well. For somebody interested in endovascular therapy, do you believe that having an extra year of training beyond interventional, because this I hear that's from the fellow, is important?
Absolutely, absolutely. The training that you get in general cardiology and interventional cardiology just gives you a taste of endovascular interventions. Just because you do a coronary intervention doesn't mean that you're equipped to do an endovascular interventions. There's guidelines that you have to learn. There's wires that you have to be facile with. The equipment is completely different. The approach is different. So trying to transplant what you learn in coronaries into the endovascular field is helpful, but you need a lot more than that. So a dedicated year, which is what most serious programs do. That's the experience that we've had at Mount Sinai and other elite institutions, is to expose the fellow to a year of endovascular interventions, where you have enough volume to develop the experience that you really need.
And you are completely driven and focused on every day you do legs.
Absolutely. Yeah, I mean, you do legs, you do subclavians, you do carotids, you do acute limb, you do endografts. Yeah. So it is there's a lot to learn in that year.
Yeah. So beyond just the peripheral, as you said, yeah.
Correct.
Well, Dr. Wiley, thank you so much for giving us an overview of how New York Endovascular Symposium evolved over time and the importance of education as a main mission of the conference. Watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from New York 2024. Thank you so much.
It's a pleasure.
Thank you.